Pillar 5, Data-Driven Research, Reporting, and Innovation. The National College Health Assessment, NCHA, survey provides the college with data that can be used to get additional money for the college, as well as identify the types of services that are needed. Santa Rosa Junior College was also able to help students during and after the 2017 Tubbs fire. After students completed a survey, SRJC contacted them to let them know where they could get help with things like replacing their laptop, information regarding workshops on grief and stress, and resources that could be shared with their family.
Always have expectations and hopes and aspirations that our programs will serve the number of students and be successful, but unless you evaluate these programs, you will really have no quantitative basis to make an assessment of whether it's successful or not and how to improve upon it, which is the most important thing.
Another tool that we use to assure that we're data-driven is the National College Health Assessment Survey. This is a standardized instrument used in college health settings across the nation. And we implement it every 3 years on a regular basis, and we identify benchmarks that we can monitor to see how effective our programs might be in student health status, behavioral changes, perceptions, and demographics in general. We use this data in a number of ways in our program. We evaluate our programs with the Student Health Services Advisory Committee. We also use this data for applying for grants, which has been very successful. And we've used it to articulate to our staff and faculty about the healthcare needs of our students to help partner with them in terms of providing support.
So the data is very important, and we do collect a lot of data. We're part of a national survey. There's some really good benchmarks, and it helps us identify on trends that are happening with our students. And we'll see spikes, for example, in student anxiety. So then we know to deploy our mental services. Sometimes there's trauma because of something locally that happened. For example, last year when we experienced the fires, we knew that there was a high need for psychological services, and we were able to do that.
And we also use the data and share it with our community. For example, the mental health needs of our students were articulated to the County of Sonoma as they were preparing their Mental Health Services Act plan. And based on the data, they included Santa Rosa Junior College as part of their plan for the prevention and early intervention. It's data that our community wants to know. Many agencies want to have access to young adults and knowing what their needs are and then being able to work with us to have their services come onto our campus is something that they appreciate greatly, and of course our students benefit from tremendously.
Our Student Health Services is not the only program responsible for maintaining or improving student health, but obviously it's critical, and it's our endorsement of their efforts by having a stated institutional student learning outcome of maintaining or improving health. And our Student Health Services has taken that to heart, and they have the same program learning outcome of improving or maintaining health for students, and they set their program goals and plans to that end, and then we measure that end, the success, ultimately through institutional level student learning outcome of maintaining or improving personal health.
When you have comprehensive services, you're able to gather some really good data that informs your decisions.
At Santa Rosa Junior College, these 8 pillars provide a strong foundation that structures all aspects of student health. These 8 pillars are designed to help create a healthier and more successful student community.